One. Hello and welcome to another episode of the Roundtable. We're going to be continuing on our previous episode about biomechanics in the squat, bench, and deadlift. And today we've got Chris on, who's going to be helping to facilitate this conversation further. So what we spoke about, if you haven't watched the previous episode, was mainly core competencies in the squat, bench, and deadlift and how it relates to center of mass. If you're doing those things really, really well, most oftentimes you're going to be squatting to depth, benching to depth, leg drivers on, deadlifts are being locked out pretty well, right? However, when we aren't doing those things or the body's not capable of being able to perform that task, usually what's going to happen is we'll start to see compensations. So we didn't talk about it in the frontal and transverse plane last time. So all we spoke about is watching it from the side on angle. So I wanted to bring it to you guys. When do you guys think it's appropriate to start altering or trying to change the biomechanics of your lifters before there's any sort of pain starting to come up? Sam, did you want to open things up?
Yeah, sure. I think the biggest thing is when I look to intervene with anything in those planes is if I can see they're like losing force production, or let's say, for example, like we're working through a block and it gets to like top end where they're hitting like, a double at 8 in our first block together or a top triple or just like a heavier set. And I can see that that technique breakdown is what's causing them to miss the lift. Then I would start to intervene a little bit more to make that movement a little bit more efficient with the blocks to come. And that's obviously before any pain is attached to any of those compensations as well.
Yeah. Leanne?
Yeah, I agree with you, Sam. I guess a lot of it comes down to performance if you're someone who is competitive. So I guess looking at movement in a way that's going to improve their performance and strength. So you can see technically like that something could improve their strength, then you're going to kind of veer in that direction to improving it. But I guess kind of looking at both sides, it's like you're not going to go and change the whole thing if you don't need to. Again, just like slowly over time, things will start to kind of piece together.
Yeah, I think when we are looking for like maximal force production in squat, bench, deadlift, right? Like at some point, the body's going to pretty much utilize every strategy that it has possible. In an extension-based sport for us, it's like you're maximizing all those capabilities. So at some point, once you reach all those ranges of motion, it's going to start, I guess, changing the shape of the body. And this is where Chris can come in and really delve deep into this kind of stuff, because although I think like you can have presentations where there's no sort of pain, right? But also when there are those kind of compensations and you're getting these imbalances, pain is usually quite present. And it's not to like nocebo people into saying like don't make compensations, but it's pretty likely for something to pop up, right? So when you're working with someone, Chris, like how often is it that when you look into it, it's like it's clear that there's these compensations stacking upon each other?
Yeah, I guess like Sam and Leanne and yourself nailed in terms of when you would actually look to change someone's biomechanics of a lift. Because like you were saying, you want to try to change these things to improve their performance before pain comes in as well. So with these compensations that you'll typically see, like Sam said, it's going to be at the top end where we are, under a maximal effort. If someone's going for a heavy single at 8 to 9 RPE, right, we are going to see these compensations or I guess energy leaks come out a lot more. And that's just because it's the body's way of trying to find the most effective way of producing force or the best way that it can produce force to complete the lift. Because our body doesn't really know, how to complete this lift in a technically efficient way. It just knows how can I complete this job as best I can. So that's why you'll see like for some squatters, a lot of knee valgus or internal rotation of the knees when they're squatting, because it's their body's way of being like, how can I push force into the ground? So I guess in terms of what I would do when I'm working with someone to combat these compensations or these strategies that their body are working with is look at their micro, look at how they're lifting and where we can improve these, I guess, lifting efficiencies as best we can through accessory movements in particular. Because I find that the less that we can, I guess, mess around or technically change the top lift, the better in some cases, but some cases you do need that technical aspect where you are saying, hold your center of mass that little bit more forward, or think about pushing down your big toe, things like that. Those little cues that would work really quite well. But for the most part, for me, I think that using accessory movements work the best because they sort of train your body and expose your body in those positions that you may not get it when doing a bilateral movement or a compound lift, if that makes sense.
Yeah. What I guess advantage do you see using like accessory movements and like unilateral stuff in comparison to bilateral? How come bilateral isn't the way to go from your perspective?
I think it's case by case. I like to try to keep athletes as bilateral as possible with most movements because, for the most part, I think that not a lot of athletes have autonomy. It's very hard to mess up unilateral movements, especially if you're looking for a specific thing or a specific cue with the movement or outcome, right? So the more that we can keep an athlete doing a bilateral movement, the better. For example, like RDLs, a lot of athletes benefit from doing RDLs, but in the odd case, an athlete may benefit from doing a split stance variation of sorts just to get a different outcome that they may not be getting with the bilateral. The other reason why I would use a unilateral compared to bilateral movement would be for, I guess, let's use squatting as an example here. I like a Bulgarian split squat as an accessory. I think almost every athlete should be doing them. The reason being is because 1 + 1 for me doesn't always equal 2 with the lower body. So you may find that sometimes, you're pushing more with one leg than the other. Like I found that recently with a few athletes that I've seen that they can't push really well with one leg, but they can push really well with the other. So they're finding that they're getting on their squats, they're getting a massive quad pump on their right leg, for example, but not much feedback on the left. And that can be coming from the hips, or it can be coming from, the inability to actually push through that left leg, for example. So using something like a Bulgarian, where we're cueing them, keep your knee forward, push through that forefoot, will really focus on trying to emphasize more of that transfer of force into the ground and keep them holding that knee forward position that you'd need for squatting. So that way you can actually increase that strength because it's not seeming to get exposure when you're doing a bilateral movement. Does that make sense?
Yeah, for sure. And I think we had a chat about it a couple of weeks ago, and one important case, and I think it's relevant here, is like when it's appropriate to use cueing as the main driver to bring an outcome versus using a constraint, right? So for people that aren't able to, I guess, like have the kinesthetic awareness to know the outcome and put their body in that position, I guess as EPs, like you're seeing a lot of people that come into pain and they have these compensations. So I guess there's inherently some sort of inability to get into that position. So what's the balance between you using like a more cue focus versus a more constraint focus in the context of rehab?
Yeah, I guess for me, more constraint focused approach would look at if there's actually like pain in a certain degree in a movement, or if it's restricted in some capacity in that manner. So for example, like if someone's dealing with low back pain and they can't squat past parallel because, anything past parallel, they'll have a flare up of sorts, right? That's where we would use something like a constraint. But if someone is, just not able to hit depth because they can't hit depth, then we would use a cue approach rather than a constraint approach in that case, where we would say, I know something like get your hamstrings to your calves, for example. Something like that could work quite well if the athlete is just struggling on depth purely from a lack of feedback from their own body, rather than it being a limiting factor from pain or a mechanical restriction, if that makes sense.
Yeah. Like it sounds like rehab is it's very similar to, I guess, just regular lifting, right?
Yeah.
The only thing is when pain is present, you do need to be a bit more cautious, and that's where you come in. So I guess problem solve a bit deeper than what a coach who's like, it's not really our scope to be able to fully assess everything, right?
Because I think that, a lot of coaches recently have gotten a lot better at adapting an athlete's program when there is something like pain that's present, but it may not always fix the cause. And that's, I guess, where we would come in a lot more and do that deeper problem solving, where we are looking at finding the cause of the problem rather than fixing the symptoms, if that makes sense. Because I think that a lot of the fixes that are being thrown, that do get thrown around, are simple fixes or symptom fixes, if that makes sense, rather than it being fixing the actual cause of the issue.
Yeah. I wanted
think,
to take it. Oh, sorry, you go, Leanne.
Sorry. Yeah, I was gonna say, just to add on to that, like I think from a coach's perspective and like programming, there's a lot of things that you can do in terms of the program to like manipulate. So like whether it's volume, intensity, that kind of thing, and then kind of assess from there. And then if it's like they're still getting this pain or this issue is still kind of presenting, then that's when like we would then go and refer. I find, yeah.
Yeah, like at the,
Danny.
I was going to say, like the coach's toolbox, I guess, for us is like if pain's starting to come up, right, it's an indicator for us that there's too much stress going through some area of the body, right? So the tools that we have available is to dial back training, dial back intensity, volume, perhaps change the exercise selection if it is like inflamed to some sort. But if it's something that's reoccurring, that's where someone like Chris can jump in and actually assess what's happening biomechanically. Because no matter what we prescribe to someone, if it's just the movement pattern itself, it can only tolerate so much.
And I guess like the point of difference as well can be sometimes that, an athlete squat may look, technically sound and there's no real issue that, maybe a coaching eye can see. And that's where we could come in and look a bit deeper and see, what's actually going on from our level of biomechanical knowledge to see, are they holding, too much extension in their squat? Is it, are they flexing at the wrong time or something like that? Maybe something like that's really technical that we may see that, a coach may not, if that makes sense.
Yeah. I wanted to bring it to a point where it's like we've got our coaching eye and what we generally see are these, I guess, easy to spot compensations that everyone can really see. So I guess in the squat, what I've seen is like you'll see a certain type of twist in one direction or a hip shift. I guess I kind of want to open up this discussion of like asymmetries, right? So everyone's asymmetrical to some point, but how much of a degree do you allow it to happen before you need to kind of change things?
Yeah, that's a good question. So I guess if we use like that twisting you're saying in the squat or the hip shift, right? I typically find that can occur from one of two things. It's it's more likely going to be like a lack of range of movement occurring at the pelvis. So when we're squatting, right, we'll need a degree of external rotation and internal rotation of both femurs, and also the pelvis's ability to what we call nutate and counter nutate. So essentially it's more or less the pelvis opening up and closing, right? So I've actually just got the pelvis here. See if I can unblur my background real quick. So with the pelvis here, we've got nutation, which is going to be more of, I guess, this opening up position here at the bottom here. So you can see sort of like there's a big open space at the bottom of the pelvis. And then counter nutation is going to be where the two pelvic bones on the side and the tailbone sort of all come together and create this sort of, I guess we can call it like a trampolining effect, right? So if we think about a squat, when we're descending in a squat, we want to be quite, I guess, opened up when we can descend. So because that's going to give us a lot of space to move. And then as we're pushing up or standing up out of the bottom of the hole, everything's sort of going to close up and go the opposite way. So think of it like a trampoline where we're opening, coming down into the hole, closing the pelvis and standing up. If that makes sense. The reason that that's important to know is because when we're going into the squat, if we don't have enough range of movement at one side of the pelvis or one of the femurs, we will see a shift to the side that can create more of that range of movement. So if it's a shift to the right side of the squat, so yeah, we're shifting to the right, it can typically be that either the right side doesn't have enough external rotation or the left side doesn't have enough internal rotation. So it's going to be one of those two things. So for us, it's going to be finding out which one of those two things it is, and then obviously, working to solve it, creating more range of movement on that one side.
Yeah.
And then I guess to follow up with that there, when is too much asymmetry a bad thing? When we start to see technical inefficiencies or movement inefficiencies, a lot of energy leaks, or I guess when you know what the lifter typically would look like lifting, if that makes sense, and they're starting to change their whole squat pattern, for example, or they're not able to, complete the lift to comp standard. That's when we would start to look at, why these asymmetries are happening.
Yeah. So for example, someone who already has like a lot of knee valgus, you're kind of used to seeing that, but then something else changes on top of that, right? So like you're noticing a new compensation on top of what you already know to be, I guess, the end range strategy for someone to produce force.
Correct. And I guess if we use knee valgus again, that can sometimes be an inefficiency of not being able to produce force into the ground. And if we can correct that, then we can typically see that there's, I guess, not a lot of inefficiencies compounding on top of that, because we're able to produce a lot more force into the floor rather than the energy leak coming in through the knees, if that makes sense. Because more or less, like, our body's trying to produce force in that case through internal rotation and flexion, which is why you'll see a lot of lifters that do create a lot of that knee valgus have quite a grindy squat. Like if you look at someone like, potentially Amanda Lawrence, or even like Leanne, like your squat, sometimes when it does get heavier, you get quite fatigued. You'll see that the knees will dive in quite heavily. The lower back and the upper back will start to flex and will start to turn into that sort of, C-shaped spine where we are rounding quite a bit. And that's just our body's way of trying to create as much force as we can in a strong position.
Yeah.
With
I guess
with like a lot of these, just really quick, with a lot of these like compensations, I feel like a lot of it, like, with athletes that we work with, comes down to like maybe them being a little bit self-conscious of how the actual lift is looking. So I think you like raised a good point there, Chris, in terms of like, what is the athlete's normal movement like? So then I think like with like from a coaching perspective, a lot of the conversations that, we can have with our athletes is like, if it is a little bit asymmetrical, first establishing, okay, is that normal for them? And then even just like, communication back and forth, like, did that feel strong? Yes. Okay, sweet. You're good to go. Yeah. So I think like maybe like from a coaching athlete communication standpoint, early on asking like questions in terms of how it felt, does it feel strong? Getting a snapshot of their kind of baseline movement and conversations and how their kind of symmetry looks. And then just understanding that, yeah, if they feel good, keep going. Or if we start to see more of these kind of further leaks or conversations happening down the line at heavier load, then making a call on whether we need to act further.
I guess that was squat. We still have like bench and deadlifts that I also wanted to cover. What do you typically see when it comes to bench? Like I would assume a lot of it would have to do with more so the rib cage, shoulder, humerus, all those types of bones and how they move.
Yeah. So I guess you can look across all three of the lifts in sort of like that internal, external rotation sort of lens at this point, I think, because the ER or the external rotation will create space for us to move into the position. And then IR is sort of our ability to create force and get us out of position, right? Or out of that space. So if we're looking at bench, you'll typically see a lot of lifters that will either start to fail or get fatigued if they can't hold an externally rotated position. You'll start to see all of those movements where, the elbows will flare significantly, their chest will start to collapse, everything will sort of, I guess, fold back into that sort of, we're pushing ourselves into the bench really hard rather than it being keeping that rib cage up and pressing. So that's when you can start to see from, I guess we'll start from the arms, more of that internally rotated humerus or IR flared elbow position. And then even some cases, the scap sort of rolling forward as well, which is quite a big one I've seen recently. But then that other one which is the big one, is that rib cage sort of collapsing as well when we're under that heavy load. What have you guys seen in terms of, I guess, from a coaching perspective that you've seen your athletes deal with? I guess we can call it technical failure from a benching standpoint.
I think that like you mentioned, the shoulders kind of coming out of place is more common with the new like rule with the depth. So like a lot of people are kind of having to bench with a lot more IR. So it's kind of like leaving them in that position. Whereas the tucked position, a lot more people can't hit depth with. So that's something that I'm finding is like, the shoulder is kind of shrugging up and like losing position, especially off of the chest.
Yeah.
Yeah, I'm very much the same. I've seen the same thing. And I think it doesn't necessarily have to be for depth, but it does bring that out as well. But when you do start to see people come out of the hole and they're pressing, like you said, Chris, shoulders start to shrug out of position to, I guess, try and gain a bit more internal rotation. I find that to be pretty common. I think of it more so like a strength deficit. If one part of the body is unable to like produce enough internal rotation, the whole system's going to try and do that to complete the task, like you said, right?
Exactly right. And that's a big thing that you'll find across like any lifter, right? If it is a maximal load, they're going to push and try to create that job or finish that job as best they can, regardless of if it's technically efficient or not. And that's just the body's way of completing job X, right?
Yeah. I think one part that gets a bit sticky then is, I guess, when one side starts to tip over, or you're starting to see like an uneven touch on the rib cage, where it's not so much like you're looking at it from a sagittal perspective where it's like both sides are struggling, but it's like one side's trying to do more job than the other.
Yeah.
What's happening there from your perspective?
There can be a few things that are happening there, which is why I guess bench is the most technically complicated or complex lift out of the three, in my opinion anyway. And I think that the big thing is like, you can boil it down to almost 2 to 3 things. The 2 big things that I look at is how can they hold their rib cage position, like under these loads, and what do their scaps do? If we look at those 2 things, because everything more or less feeds off of those, right? So this is, saying that, things like leg drive are already going to be a constant. So leg drive's fine. If we look at the scaps and the ribs, if the scaps aren't moving how they should, or if we're not able to hold sort of like, I guess, more of a posteriorly tilted position in most cases with the bench press, then we are going to find that there may be an uneven press on one side. Like I saw a lifter yesterday who wasn't able to retract their right scap as much as their left, and then when they are coming down onto the chest, the left scap the left side of the arm is able to hit the chest a lot easier, because they're not in as a protracted position. So it's less range of movement for their arm to essentially travel. So things like that, looking at the scaps and looking at the elevation of the rib cage are really, I guess, the 2 big things for something like an asymmetry of touch point, for example, or one side working more than the other.
Yep. And I guess it's hard because it's always case by case, right? Yeah. That's where things get difficult. And if you don't know what you're looking for, it gets really hard, especially for a coaching perspective, like to see what's happening, I guess, from that like frontal view. Almost you need to look from like a bird's eye view when you're looking for those kinds of things as well.
Because like, I guess the other thing to note with, say, like you said, an uneven touch point, or if the bar's twisted when it's coming down to the chest, could be that, they're holding too much ER on one side as well. So there's a few things that do actually go on there as well. Not so much just looking at the scaps in this point, because like I was saying, if one side can't retract really well, then that's going to leave them in more of a protracted scap position. So one side just being a little bit more around the rib cage than the other. And if that's the case, then that right side, so we use the right side as the example, as the side that's not able to retract as hard. If that right side can't retract as hard, it's going to have to be into more of an internally rotated position to be able to get down to the chest, because the scap's just not able to hold more retraction. So that left side will be able to hold ER really well and get down to the chest nice and comfortable. But that right side's going to be, out here, no man's land, trying to be, I guess, coming down to the chest like that.
Yeah. And over time, it's just going to create more and more of this, I guess, turn if you're just going to consistently keep trying to drive that movement pattern.
Yep, exactly right. And that would potentially, once, like again, we've said before, like with the squat, if you start to see a performance decrement or like a decrease in performance, that's when you would start to address those types of issues. Because sometimes these issues actually just do correct themselves, given that the movement micro or that the accessories that the athlete has are what the athlete needs, not just something that's thrown in there because, they need to do rowing, so we'll give them rowing. Making it specific to what the athlete would actually need. So for example, if you know that the athlete struggles with something like this touch point issue, giving them something that's going to focus potentially, obviously given the individual, more retraction focus would work really, really well.
Yeah. I think I want to dive into that a little bit deeper now that we're talking about it. When you are prescribing accessories such as that, right, where there is this sort of like movement deficiency because I guess they've created these like, I guess, compression strategies, right? So what's the difference between prescribing an exercise to improve strength versus a rehab setting where sometimes it's not so much about the load versus just getting that joint angle and just getting things to I guess, develop the ability to get that range of motion back?
Yeah. So what what all three of you may have found by sending your clients to, Tom, Josh, and myself, is that it's the rep ranges that will be the differing point. So more times than not, if it's like, and we use bench as an example here for like bench and bench accessories, if it's a strength thing or a strength issue that we're just trying to, get load in that spot, we'll give them something that is hyper specific, or not so much comp bench, but specific to the bench in that case. So something like a machine chest press, dumbbell bench, something along those lines. That is, I know three or four sets by 8 to 10, something like that, where they can push load quite hard and it won't really affect them too much. If we are looking to drive more of that strength stimulus. But if we're looking to drive more of a movement and, like you said, improve range of movement, get the joint angles and things like that going, then it's going to be more of that higher volume or higher volume sets rather than a lot of it. And I typically put them either at the end of the session or the following session. So if it's something that we need to address on day 2, I'll put it at the end of day 1, or I'll put it at the start of day 2, if that makes sense. So sort of like, I guess, what people would typically term prehab in their program. So if we look at that bench example again, if that athlete is needing more retraction on the right side, I'll give them something like, 2 to 3 sets of 20 to 25 reps on a chest supported row, where they are focusing on, retraction and nailing that retraction. And I'll make the RPE something like 5 RPE, so it's really hard for them to, overshoot it. Because 1, they're going to get gas from doing 20 to 25 reps in the set. And 2, we really want the focus to be on retraction. So typically I find if athletes do push those movements or those movement micro enhancers or helpers too hard, they're just feeding into their issue straight away. They're not really addressing what the point of the exercise is. Does that make sense?
Yeah, I can, I guess, admit to that as well. Like when there are, so because you could have the exact same exercise, right? But if you do it with high amounts of intent to the point where it's like you're just using everything, it's just one big compensation once again.
Yeah.
Right. So the intent really matters when it comes to the accessories for rehab.
Yeah, and exactly right. And I think that there is a fine line between it being rehab, like where we are dialing intensity and volume back in that sense, where it's, quite light load. But for the most part, you can actually push these things quite hard. So like, for example, an athlete that I saw with elbow pain, does need to improve something like pronation for their elbow pain. And you can give them, 3-4 sets of 20 or 15 to 20 reps for that there to, really gas up their tricep A. So you're getting a hypertrophy response there on their tricep. And so they're feeling good about getting a pump, but you're also getting what you need out of it by improving that range of movement. So it doesn't necessarily need to be something that's, low load, where the athlete's like, oh, I'm doing my rehab. You can still train hard when you're doing these sorts of things too. It doesn't need to be always like low load, dial it back, you're hurt type of thing, because then that sometimes can feed into the athlete mentality of, I'm in rehab, I can't push training hard. Does that make sense? And that's what I found sometimes too.
Yeah. And I guess to finalize things as well, we've covered squat, we've covered bench. What are some common things you guys have seen with deadlifts in terms of compensations?
I want to pick Chris's brain. We just started to delve into this before with Leanne's squat, but like the whole like flexion versus extended debate and like whether or not flexion's bad. I guess, Chris, if you can comment in terms of like a deadlift sense, like let's say sumo or conventional. Let's say a lifter is, presenting with, more lumbar flexion, but they don't have any problem like locking out or like hitting a set at top end. Do you see that as something that you would address for like long-term strength and health?
Not necessarily. Again, so I've seen a few athletes that do deadlift both ways. One athlete being, quite upper back rounded, the other athlete being, quite lower back rounded. Both are fine. Like it's a case of like your body will adapt to the stimulus it's put under. And unless, like we've said throughout this episode, if there's a performance decrease, then we'd address it. But I think that for the most part, if it's an athlete that's dealing, that's deadlifting, with more lower back rounding, it's fine. Like there shouldn't really be an issue. If there's no performance issues, like they can lock deadlifts out. They're not really feeling like a massive low back pump or anything like that post deadlifting. I wouldn't necessarily need to worry about, holding more extension or something like that.
Yeah. Do you feel like problems kind of arise more if, say, for example, they had like more flexion, but then also a shift attached?
Can be sometimes.
Yeah.
But that's where you would then, like, if the athlete came and saw me, for example, or as like some of you guys have done with your athletes in your programs, if they are quite a lumbar flex deadlifter, for example, cueing them with an RDL to hold more lumbar extension can be the way to go as well. Then they're still getting the exposure to the extension, because we will need extension irrespective of any lift that we're doing. But getting them that exposure, not mucking around with a top lift or their compound lift, is probably the best way to go.
Yeah. I think with specific to deadlifting, right, and having that lumbar flexion presentation, especially off the floor, I think it's always going to happen off the floor, right? If anything, that's our body's way to try and minimize that moment arm from the hip to the bar, to try and make, I guess, getting off the floor a bit easier, because we all have that natural impulse to just want to get it off the floor. If it's not coming off the floor, there's no point in doing the lift, right? So the body's going to try and flex and get itself into position in order to, I guess, initiate the lift. But like Sam alluded to, it's like the problem is when you overuse that strategy and it becomes a point of you not being able to reverse it and try and re-extend to try and lock out. That's where things become problematic.
Correct. And I guess one thing you'll see with those athletes that are potentially more lumbar flexed when they're lifting, is that they will struggle to lock out. They might struggle to get past their knees. And that's just because that excessive amount of lumbar flexion can cause soft knee at lockout, because it's the lack. It may allude to the lack of ability to extend the hip itself. So like Sam was saying, if the athlete can extend the hip, lock out the deadlift, no reason to address it. But if you're finding that they're getting stuck at the knees, stuck on the thigh, hitching, soft knee lockout, stuff like that, it might be a case that we need to address more hip extension at the top part of the lift rather than changing the whole lift itself.
That was night and day for, like, if let's take my deadlift, for example, like, back when I was pulling, say, 300, I'd get pretty rounded at, 300, 310, and I had so many misses at the knees, because I would, flex off the floor. I'd get to the knees and I'd just be in my heels and wouldn't be able to, like, stay extended and keep pushing to the ground. So, like, back in whatever year it was, I think after I ran sumo, I slammed like a heap of extension work with Kelly, was running sumo, and then I went back to conventional. Then all of a sudden my conventional just like popped off, and it was purely just because I just slammed like extension work for 6 months and got stronger in my low back. And then now, like, keep doing that within my program, and like it was like probably one of the biggest factors outside of programming that helped me get to like 340, 350, 360. It was like night and day.
I think there's another. Sorry, you go, Chris. I was going to say there's another factor that can go into that, which is like getting the legs strengthened as well, right? Because if the legs are unable to perform the task, that's where the back wants to kind of like alleviate the load to start off with. But if the legs are strong enough to overcome that force, you won't need to flex as much.
Yeah, to a degree. I guess the flexion in the lower back can sort of use the lower back as sort of the bridge between the upper body and lower body, right? So if the legs are pushing really hard, and the strength isn't really a leg issue, it might be a case that the upper body is lagging too much. So there's not enough, for example, maybe erector strength, which is why that you'd find that there's that lower back or that fishing rod style of deadlift as well. Where again, if the athlete is strong enough, they'll be able to lock it out, because they'll be able to just, stand up with the bar, like reef their upper back up. And that's where you'll find athletes getting that erector DOMS the day after deadlifting, because they're like, oh, my back's so sore from deadlifting. But if an athlete can, like Sam has done, create more strength through extension biased work, if they are more of a flexed style lifter, then that's going to be sort of like the key or the missing piece to the puzzle that can really help them, I guess, improve their deadlift. Because if we think of everything as a continuum, sort of between flexion and extension in this case, if you sit too far down one side of the continuum, you can't really go anywhere else if you're already there, right? So you need to go back the other direction to create space to go toward what you need to. So if you're sitting in a lot of flexion, do some extension accessories, And then that way you can go back to flexion really comfortably and a lot stronger.
Yeah. I want to throw one more quick question before things start to tie off. Deadlifts is probably the only one where there's this innate, like, natural imbalance due to mixed grip, right? So what about the case where, say, one hip or one knee is starting to get soft, whereas the other one is pretty locked out and it's fine?
What I would do straight away is looking at what's happening at the ribs and the pelvis. So similar to, I guess, maybe like what we can liken it to is the hip shift in a squat. Look at hip extension differences left and right is a big one to start with. And then the other one would be looking at what the scaps are doing as well. So if one scap, for example, is a little bit more retracted than the other in this case, for like a twisting in the bar when locking out, that could be the case. But more times than not, I think for myself, in my experience anyway, it's going to be something liking more towards hip extension if one knee is soft and the other is, I guess, locked out. Because like I was saying before, soft knees is a compensation for lack of hip extension for the most part in a deadlift. So it could be that one side is just lacking, which happens from time to time as well. So if we can address the lack of hip extension, then that can typically fix the hip shift issue. Oh, sorry, not the hip shift, the
knee issue.
Lockout, I guess.
Yeah, for sure. Well, I think that pretty much covers all we had for today. I think this episode will definitely need a couple rewatches for everything to start to sink in, because there's a lot going on in this one. There's, relationship between ribcage, pelvis, and how that feeds into squat, bench, and deadlift, and all that, I guess, presents very differently every single time, right? Yep. I mean, looking at accessories is also another really big key when it comes to rehab. But at the end of the day, I think as well, if you are experiencing pain, having someone such as Chris or an EP to be able to properly assess and get to the root cause of why you're compensating the way you're compensating is going to be fruitful long term. Because especially in like a peak setting, right? Like sometimes you just don't want to think about it and just get through it. But when things start to settle down, the same patterns are just going to keep reemerging unless they get addressed.
Yeah. And I think like even in cases like a peak, it's not too late to get minor changes done in that can really help an athlete get through the comp as pain-free as possible, I guess. Because it's been cases before in the last sort of, few competitions that have been run that athletes have reached out, in their peak week or, 3 weeks out of comp being like, help, I've cooked my back. I can't move, they're 20 years old, moving like an 80-year-old, something like that. So it can be done. It's just a matter of, reaching out, finding help.
Yeah, for sure. All right. Thanks guys for listening, and we'll see you all in the next episode.